Oh, there we go. It is recording. Greetings, colleagues. We are very excited to finally get to the point where we are um, having some conversations regarding an athletic training academy and the National Academies of Practice. Right now, we have 27 participants on this call, and we have probably 60 people that have showed interest in being involved with this. But we are recording it so people can save it. Just a couple of ground rules for everyone. During the initial presentation with the people from the National Academies of Practice, if you want to keep your microphone on mute just to kind of maintain some decorum, but feel free to shoot questions out via the chat window. And we can share them with the people from the Jody and Melanie and Michelle from NAP, and then when we just talk later, we can let everyone use their audio. So, but I think initially, I think it's good just to get through the PowerPoint. Like I said, it'll be an open discussion, and this is being recorded. So, what we'd like to do is we'd like to first welcome some of the leadership from the National Academies of Practice. We are very happy to have Jody Frost, who's the president of the National Academies of Practice and part of the Physical Therapy Academy, Michelle Trotheth, who's immediate past president, and Melanie Bowser, she's a part of the Nursing Academy, and then Melanie Bowser, who's the executive director who basically manages the association. So I am going to unshare my screen, Jody and Melanie, and I think Melanie is going to put the NAP slides up, if that's okay. I'm going to undo that. So there we go. Yeah. Let me see. Let's see. I got to unshare. Let's see. Of course, I don't. Okay, let's do this. Okay. There we go. The NAP slides are up.
Okay, great. Great. Well, thank you, Tony. And this is Melanie Bowser, Executive Director for NAP. And I just want to say thank you for the invitation to join you all today and share a bit more about who National Academies of Practice is as an organization and how the athletic trainers can get involved. So we're very excited that you've brought this opportunity to us. And I'll just start out here with the first few slides, and then I'll turn things over to Jody. But just a broad overview about who NAP is. We are a nonprofit professional association, so we're a 501c3 that was actually founded almost 40 years ago. We'll be celebrating our 40th anniversary in 2021. And we were founded actually by a psychologist, Dr. Cummings, who was testifying and doing visits and sharing the story of psychology on the Hill in DC. And what he noticed and realized when he was doing Hill visits and testifying is that psychologists were telling the psychology story, optometrists were telling the optometry story, nurses were telling their story, and everyone was working individually. And his vision was how much stronger would the message be, and how much more impact would healthcare providers have on the Hill if we were all sharing the story collectively together about the strength of interprofessional care and the advancement and the benefits of interprofessional care for patients. And so out of that vision, he created NAP back in 1981. So our first academy was the Psychology Academy, and NAP is a group of distinguished practitioners and scholars. There is an election process, a nomination process that we'll talk about, but we are actually the oldest interprofessional group of practitioners, scholars, and public policy professionals. And again, what brings us together is the idea of interprofessional care being best for patients and their families. So psychology was our first academy, and it quickly grew to be an organization of 10 different academies representing 10 different healthcare professions, which about 4 years ago now, we actually added 4 new academies. So audiology, speech language, physical therapy. We're among the newer academies that came on board just about 4 years ago. So now we are a group of 14, and you can see all of the professions there that are currently a part of the organization. We have a couple different membership categories. So the primary category is that of Distinguished Fellow, and there's some criteria for this, primarily that you have to have been in your profession and working interprofessionally for 10 or more years. So to become a fellow, you do have to be nominated by a current NAP fellow, and then you go through an application process. Your application is then reviewed by your individual academy and also then reviewed by our full leadership body, which is called our NAP Council. And there's representation from all 14 academies on the council. So it's an interprofessional review process for the fellows. We also have another category that we just started a few years ago, actually, called our professional membership category. And the criteria is a bit more open on this in that you only have to have been practicing for 5 or more years for the professional membership level. This still does require a nomination and application and review process as well. And then our third category of membership is that of associate membership. And this category allows those that don't fit into our current academy system. So if you're not in one of the 14 professions, such as athletic training, the associate membership allows you to still join and be part of our organization today. The associate membership, there's a very small application process online, but it does not require nomination or the full review and vetting process. So it opens membership up to those that aren't in one of the 14 academies. It also opens up membership to students or those that may just have not been in their profession as long as well. And with that, I will turn things over to Jody to talk about our leadership structure.
Thank you so much, Melanie. I'm Jody Frost, the current president of National Academies of Practice, and I am a physical therapist. It's just a little bit about the organizational structure. There is an executive committee, and the decision-making body you'll see in the next slide is our council. So the executive committee is like a board of directors initially, and the council is a very different model. You may not be used to a council model, but up here you'll see that it uses a president-elect, and an immediate past president. So Michelle is our past president. President-elect is Rick Weisbarth, and I'm president. And just to give you a sense of how the flavor is different, Rick Weisbarth is an optometrist, and Michelle is a nurse. And as we go around, our treasurer is an audiologist. Joanne Weisley, VP for Public Policy, a speech-language pathologist. Sina Haynes is dually certified. She's a pharmacist and a registered dietitian. Joanne Singleton is a nurse. Al Rundio, our editor of our journal, Journal of Interprofessional Education and Practice, is a nurse, and Lauren Harden is also a nurse. One of the other things that I want to make sure you understand, the 3 legs or the foundation of this organization is really based on 3 different types of group, and it's where we award our distinguished fellows. So it's really about practice, it's about scholarship, and it's about public policy. Many of the people who are educators come in under the scholarship, but there really is not a category in this organization that is educators. It's practice-focused, public policy, where public policy really focused on the patient. And what makes this organization work is our conversations are focused on patients, not on professions. And it's very different than our uniprofessional models where each one of us belongs to the NATA or APTA or whatever the case may be. This is really the patients at the center of that conversation. And our work and our scholarship is really about how to advance collaborative practice and partnerships in practice, and how do we support that with scholarship that all helps us and build the case for public policy on the Hill. So the people you see here each have a role to advance those areas. And as you can see, our professional development, our public policy, our networking and partnerships, which is social media, as well as our partnerships internally and externally, and also membership development, recruitment, retention types of things, and Al, who deals with the journal. And then our two amazing staff who we couldn't live without. There are wind between our wings are Melanie Bowser, Executive Director, and Ashley Peter, Project Coordinator, and they know us better than we know us. Next slide, please. So the NAP Council, earlier Melanie showed you a slide with the 14 health professions. Each council has a chair and a vice chair. Those positions are typically elected. However, many times in a new academy, there is somebody who has emerged as a leader to help be the founding chair and vice chair to kick it off. One of the important things we've discovered, I have come from one of the newer academies, it's physical therapy. Two things have really helped, and our 4 new academies did not progress at the same rate. So physical therapy took off probably first, audiology behind them, speech language pathology, and then occupational therapy. The difference was having a critical mass of invested people who are willing to get their hands dirty, get involved and be on different committees in NAP as well as committees within their academy, and leadership. Without those two, it doesn't build in success. So one of the things that NAP has done as a council in developing some of its policies is to really set up any new academy for success, not failure. So some of the things you're going to see a little bit later of how you become a new academy were designed to provide, ensure, help you get to successful outcomes. And they're not designed in any way to be punitive. It's just that we've learned a lot in the last 6 years about how you make that happen. So there you'll see each of our councils, and the individual on the end who was formerly a member of the Nursing and Vet Council, she actually has that dog who is an honorary member of the National Academies of Practice, actually under veterinary medicine.
Nice bow tie. That's a nice bow tie that dog's wearing.
Oh, very handsome and very, very smart, I might add. Next slide, please. So this organizational structure initially may look daunting, but one of the things I think it's important to notice is this is not an extreme hierarchical model by design. You're looking at 14 talented, capable professions and academies who have recognized individuals who are distinguished in their profession and distinguished in interprofessional practice or public policy. So the council is actually our decision-making body. So there are certain things that come forward to the council, like an academy reviews nominations, and then the council actually votes on those individuals coming into NAP. Underneath that, you'll see an executive committee where our officers as well as our executive director are part of that. And she sits on all of our executive committee meetings, and you see staff that are hooked to everything. The other thing you'll see across our committees, and they continue to grow, there are many opportunities for individuals to engage in NAP. That's one of the real positives. So over the last 4 years, we have almost tripled the number of individuals engaged in NAP, and it's close to 300 at this point that are actively engaged in some aspect, whether it's our forum committee, our public policy committee, which has over 50 members. Our forum committee has 35 to 40. So there are many places that people can get engaged, and they get engaged at the professional level, they're engaged at the fellow level, and they're also engaged as associate members. Next slide. Michelle, are you on yet?
I don't think she's on.
Yeah, I'm going to continue. She's having a lot of trouble getting in, and she said to give her regrets, she's having trouble getting Skype to work for her.
Okay.
So like any organization, we have a strategic plan, and we have a mission and vision that we revisit every 5 years. Next year we'll be doing that, and we have annual goals that we make. Our mission, and if you read it, you'll see what I had talked about patients in the center, but distinguished professionals advancing interprofessional healthcare, fostering collaboration, advocating policies in the interest of individuals and communities. And our vision is that NAP will lead and exemplify interprofessional healthcare that promotes and preserves health and well-being. And in there, embedded, you might see the quadruple aim a bit. So you can see about outcomes, and you can see about health and well-being of everybody. It's actually embedded. Our 3 goals are otherwise known as our 3 C's, our culture, clarity, and community. So we currently are actually about ready to revise, review, and vote on a new strategic plan for next year that has new goals, objectives, and they're specific, measurable, and I'm here to tell you that our strategic plan for last year, we're just about ready to do one last thing, and we will have achieved everything on that plan in 1 year. So our accountability is really high, that people walk the talk to do what they have, and promise keeping is important. Next slide, please. NAP has 2 publications. We have a quarterly peer review online journal. It's online only, the Journal of Interprofessional Education and Practice. It's jointly shared with the University of Nebraska. NAP has a journal editor, Al Rundio. The part that he focuses on are practice-oriented issues, and University of Nebraska, Devin Nichols focuses on the side that's education. It has probably one of the most efficient systems in turnaround peer review and, if appropriate, publication of all the journals that I have actually worked with interprofessionally. And we put out a bi-weekly e-newsletter, the NAP Times. No, we don't sleep with that, but it just seemed like we couldn't help ourselves, so the title is NAP Times. And it features information about the academies, as well as executive, as well as interprofessional news conferences. We have some other organizations that share their information, like the National Center, the Global Forum, et cetera, on our newsletter to make sure all of our members are aware of what goes on. Next slide, please.
Oh, hey, Jody, I think Michelle just popped on. Michelle, are you here? Michelle?
I just got in, hopefully.
Okay, I saw her. Yep. Okay, so we'll let her make some comments at the end after you're done talking, maybe.
Sounds good. So we have an annual forum and business meeting. We alternate every other year. So one year we're in the DC metro area because we advocate on Capitol Hill, and we go on the Hill in interprofessional teams. So we actually last year did 3 webinars to help train all of us on how do you do interprofessional advocacy. We're used to uniprofessional advocacy, but primarily none of us had ever done interprofessional advocacy in the teams, and it's a different kind of messaging and a different kind of engagement that really puts the patient front and center. So this year our forum is not in DC, it's our alternating year, and we're March 12th to 14th, and we're going to be in the beautiful area of sunny San Diego in the Mission Bay area. November, I think registration opens up, Melanie?
Yes, registration will be opening in mid-November, so be on the lookout for information on that.
And as well as the hotel, and we will share with you, the hotel fills up quickly. It's a popular conference, and obviously San Diego isn't anything to scoff about. People will be there. But so you just have a little flavor. We have keynote speakers each day, and they kick off the day and the theme where our peer-reviewed symposia or workshops or research or posters follow the theme of that day. And then we actually have some this year working sessions where people can get together and begin to initiate some interprofessional cross discipline and setting initiatives and projects. We have intentional networking that not by happenstance, but really we intentionally get people to connect. One of the most important highlights beyond our presentations and our keynote speakers, who are often, I would say, very thought-provoking. This year we're having a patient panel that'll help us understand their voice. And finally, the highlight or the signature event is our induction ceremony, where our new inductees, our new fellows and professional members are inducted in a black tie event that really recognizes, celebrates their achievement, their accomplishment, and everybody is there interprofessionally to applaud the new cohort that's coming in. So hopefully put that on your calendar. For those of you who may never have been to a NAP conference, it's a great way to see what the organization's about and to really discover if this is a good home for where you want to be interprofessionally. Next slide. Michelle, do you want to do this?
Sure. Can you hear me?
We can. Welcome.
Oh,
Welcome,
good.
Michelle. How are you?
Oh, thank you. I apologize for that. I had some challenges with Skype for Business, but I just was persistent.
Yeah, that's the key. Resilience. Resilience
That's
is the
right.
key.
That's right. Yeah. So I had a chance to plan this with Melanie and Jody, so I know everything that went before this. And we actually have, under my presidency, launched a committee called the INO Task Force, where we're really stepping back and taking a look at internally how the organization is organized, which would be the O, and also interprofessionally what's happening in healthcare today. And are we keeping up as far as being relevant to the different professions out there? And so the timing of you knocking on our door is really good. And we do have a process in place for professions that are interested in the National Academies of Practice to follow. And that's what you see here for next steps for athletic trainers to consider. Is it is about coming together as a group of like distinguished healthcare professionals, and we do require a minimum of at least 7 to 10 individuals. We want a little bit of a critical mass to start out with that are really committed to becoming a academy within the National Academies of Practice, and they have to qualify for fellowship status. So the criteria that they went over earlier, you're going to want 7 to 10 individuals that meet that fellowship status, and to make a formal petition to the executive committee to form a new academy. And then we have in our NAP bylaws criteria, so that will be important for you to also be aware of, that each academy has to be recognized independently practiced, licensed, and regulated healthcare profession within the United States, and that it is based on biological, behavioral, scientific concepts. So it's really important to be part of that scholarly community at large. And then also other criteria is that, you know, you have to fit within like your own scope of practice. So we don't have member academies that are a subset of another academy. Affect a definable population of patients that you really meet a unique body of knowledge, skills, and experience for. And be one in which individual practitioners currently practice and or be required for the delivery of services to colleagues and patients. And also the last one is to have a mechanism for acquisition of the required knowledge and skills. So graduate education, professional degrees, so forth. So when it comes to what is an academy of a health profession, those are the some of the criteria that are outlined in our bylaws.
Okay.
All right, and now I think we just wanted to open it up for any questions you might have of Melanie, Jody, or myself.
Yeah, so I want to tee it up with a question first, and let other people chime in as they feel they. So basically, kind of the paradigm we are working with. I mean, obviously, with those criteria, athletic training definitely fits those eligibility criteria. I think as far as the numbers for critical mass, I think we've had quite a bit of interest. So as a result, one of the goals we were going to have is to have people starting in 2020, you know, people that are interested become associate members. What kind of role would the associate members have in the organization while we are kind of getting organized as an academy? So if you can talk to that a little bit.
Sure. Well, I'll take it, and Jody and Melanie, you can add in. So, yeah, the associate member, it gives you, you know, full access to the publications that Jody went over. You know, you'll have access to all of the communications within the National Academies of Practice. The other thing that we recently approved under this INO initiative that I talked to you about, that we are going to kick off at our 2020 forum, is to start an associate collaborative group where we can bring different professions that may not have a home of an academy right now together in a collaborative group. So you're still connecting with other professions, and that is also going to be launched and guided by members of the executive committee. So that's a new change for associate members. We have welcomed associate members in. Some of them may not even be clinical. Maybe they are, you know, have a public health background or policy background, but they're very engaged from a health profession, health care perspective. And but when you do show up at the meetings, they've been kind of by themselves, because sometimes the academies gather, and a lot of things we do together as well. So that's something new that we'll be launching in 2020 at our forum.
This is Jody. To piggyback on that, Michelle, there will be, for the first time, the Associate Member Collaborative Group will have a place at the table of the council. They're not a voting member, but they will be able to participate or be part of the council meetings. And up to now, the associate member has not. So that group will have to identify somebody who will be sitting at the table, a non-voting member, to be a part of the dialogue, and at least to be able to see what goes on in that council and to have a voice in some of the decision-making that goes on in terms of influence, in terms of persuasion. So all of that will actually be starting, I believe, in 2020 at Forum, where the Academy, the Associate Collaborative Member Group, will actually have its first meeting at the same time when the academies are meeting. They will be convened as well.
Okay, good. If no one else has a question, I have one more question for you. What type of, what is your typical timeline for a petitioning group to, like for example, I plan on going, I'm an associate member and I plan on going to the NAP Forum this spring. What is generally the petition decision kind of timeline you've used for a new NAP Academy?
I'm going to take this one because I have to be honest with you. We're pretty transparent. We have not had a new academy since 6 years ago.
Okay.
So the PT Academy, et cetera, was a different timeline. So you actually would be the first under the INO with a new academy forming through a petition process. So part of that would obviously be the completion of the documentation for the petition, and the other piece would be the timing of our council meetings, because obviously that's not typically what would be an online vote. It would be an in-person vote because of the discussion. So Tony, that actually could happen depending on when the petition submitted. It would go on executive committee meeting agenda, and then it would move forward to the council. So that would be our timeline. The council meets every other month. The executive committee meets every month.
Okay.
So at most, once the petition is filed, et cetera, it would be 2 months because of the timing of when those two groups meet. Does that help?
I mean, that's a much quicker turnaround than I was envisioning. So, the bottom line is I think what I'm hearing is that we as athletic trainers have to really organize ourselves and get the documents in order. The turnaround on the NAP side might be quicker than we had originally kind of envisioned. I was thinking maybe a 1 year process or something like that, but it sounds like really the work will be kind of more on our side to really find the people that really want to be engaged and be involved with this group, and we also want to engage with clinicians too. We kind of, the initial conversation really started out as really more of kind of through our educational networks, but I think when we open that net wider, I think we'll have some very interested clinicians out there that would be interested in being involved.
Tony, I have to give one caveat. Because once you start you'd have to have nominees who are fellows to come forward and be inducted. That's the piece that would put you off a year, because you need those individuals. And the nominees, because an academy does not exist, the council reviews that because you don't have a body yet, a membership committee to do so.
So that's that year window I was
Correct.
kind of envisioning in my head, is that there needs to be the initial group of fellows that would be recognized
Correct.
as a part of the academy. Let's say for example we have 35 people that are interested in being a part of it. Obviously feasibility wise, starting out with 35 fellows might be difficult. Do you excuse me, do you anticipate maybe having the initial group having X amount of fellows and X amount of professional members who eventually become fellows of the academy? Is that something that, have you envisioned that?
We have not had that discussion. We do know that at least 7 to 10 need to be at the fellow level.
Okay.
Because of the involvement in the number of committees that you're going to be asked to have people to serve on. they'll be spread thin. I can tell you the PT Academy had 9 when we started, and every one of us had a role. So, and some of us had multiple roles, but there are a number of committees that people are looking to have that representation and voice in public policy in the forum. On the membership committee to have a membership chair. So that happens pretty quickly. So one of the caveats might be, and this was one of the things we did with a lot of people who were interested, is that we said the first group has to be willing to roll up their sleeves and get busy and get engaged. There's a lot in terms of developing policies and guidelines. There are things about officers and vote. There's a lot of upstart. So if the individuals are not ready or don't have the bandwidth on the first round to do that, and we had some who said, I can't do that this time around, put me in the second group for nomination. That was one of the ways we were able to separate. We did double our class in 2 years. That was a goal. So we went from 1 year 9 to 18 in the second year intentionally to expand our bandwidth. So if you have more people willing to roll up their sleeves and do that, and really understand the first group is really going to be the foundation group that's bridging that group, then by all means put those names forward and let the others know. It's not that you can't be, it's just that this first group is a working group.
It's got to be a pretty strong core. Okay, good.
Yep.
Excellent. Does anyone, does any of the attendees have any questions for Jody, Michelle, or Melanie specifically?
And I guess I would ask the question, Tony, have any of them ever been to a NAP conference?
Yeah, and we just got a question actually from someone. What are the fees for individuals or programs to join? So I believe we're going to kind of go over that on our call later, but the individual associate member fee is $120, correct?
That's correct.
Okay.
This is Melanie. We actually just adjusted those fees this past year, but it is $140 now.
$140,
for
okay.
Associate membership.
Okay.
And I would add too that associate members are also welcome to serve on committees. So if you join as an associate member, you can still have committee participation, which would give you, jumping in with both feet basically into areas where you can get involved and engaged early on.
And trust me, they also tap you as a reviewer for abstracts for conferences and stuff like that. So I've already been tapped.
All right. Hey, while you're on, Melanie, can you give the fees for professional and fellow?
I can. So associate is $140. Professional, so there is a $50 application fee for the professional membership. And I would have to, and a $100 application fee for the fellow. And just pulling up my information on the.
And those are counted towards the membership, correct?
No, those are separate fees.
Separate, okay.
Let's see. Dues for the professional member are $220. And dues for the fellow are $275 for the year. And we do have calendar year dues, so they go January to December. However, those, if you do want to join as an associate member now, we're so close to the end of the year, we would essentially allow you to be a member between now and December 2020 for that one-time fee of $140.
Yeah.
Good info. Anyone else have any questions? If you'd rather not speak, you can always type them in the chat window, and I'll ask. I don't mind. Why Melanie and Jody and Michelle are on the call? Well.
Hello. Can someone hear me?
Good.
Yes.
Okay. Yeah, I had trouble getting in on Skype Business too, and so I don't know. Are you guys going to make this available? I don't know what fellowship status, what the requirements for that is. You made reference to the fellowship status and those type of things, what is needed. I don't know if you can go back to that or when we can see that information or where I can find that information out.
Yeah, it was on an earlier call. Actually, I'm going to be getting to it on some slides. It was on an earlier slide, and this is I'm recording this.
Okay.
I think they can explain it also if you'd like.
Yeah.
But but this is recorded for sharing. But does Jody or Melanie or Michelle, any of you want to kind of give him some detail on the fellow status?
Melanie, why don't you take that one again?
Sure, and I can actually jump back to that slide as well. The primary criteria is that you've been in the profession for 10 or more years, and that you have certain accomplishments and honors within your individual profession, as well as contributions interprofessionally. And we do have the 3 different categories of fellow: Distinguished Practitioner Fellow, Distinguished Public Policy Fellow, and Distinguished Scholar and Fellow. And you can find more information about this on our website as well, which is napractice.org. You can see our website here. And there is a page with a lot of information about the nomination and membership criteria process.
And we're going to hop on that a little later in our call, in our part of the call.
Yeah.
So, yep.
And this is Michelle. If I could just add a couple of things. I do think that as you look forward in your planning, to think about the balance between the education side and the practice side. I think that was a really good point you brought up, Tony, is to go into this with looking at both sides of the equation of how you're advancing interprofessional care, along with fellows and professional. So I guess from our experience in giving advice to a new academy, we would encourage you to look at all aspects of that. And like I mentioned too, we are actually going to be, there's a lot of support for new academies, as well as there will be for the associate collaborative that we're starting.
I got a couple more questions. How large are, from a fellow standpoint, are most of the academies? So what is your largest academy? About how many fellows are in that? And what are some of your smaller academies?
I was going to say, Melanie, I think, has the current numbers. The largest academy is nursing.
Mm-hmm.
Hands down. There is currently there is a maximum size an academy can be of 250 members, active members. So that's not people who are retired or whatever, but it's 250 active members. Because the design is such that it really is trying to identify and highlight those individuals who are both recognized in their profession and recognized in interprofessional. And there is a new rubric that is being used that is it makes it selective in how individuals are coming into this academy at the fellow level. The professional level, it is probably not as restrictive as you wanted, and obviously the associate member. So I believe they're the largest. The smallest academy, I'm not sure. Melanie, can you put that back up? You had the smallest? There are
Sure.
several smaller academies, and those in mid-range.
They really range generally anywhere from 13 to, as Jody said, nursing is our largest, and they're at about 180 now. And we do have one academy that has fewer than that, and they're one of our newer academies that has had some challenges and not had that critical mass at the start, and so they have just a handful of members currently, so we're really working with them closely to try to increase and advance their involvement. But total number of fellows, we have about 650 fellows and about 16 professional members. So that professional member category is one that we're still really working to grow across all the academies. And our associate membership as well, we're really looking for that to grow. We have just under 10 associate members now, so we're looking to grow that category as well.
So athletic training comprises 10% of the associate membership, which is kind of cool. Okay.
It does.
Okay, so another question. What is an example of one or two of the strategic goals the Academy has worked towards this year? So what are some of the, when you did the strategic planning, what are some of the goals that you kind of put in action to accomplish this year?
Sure. We actually have them across all of them. One
Yeah.
is a very large goal, creating a NAP registry.
Mhm.
And the NAP registry is beginning to collect and assemble information from the members on interprofessional scholarship to begin to figure out how we can start connecting, start working with each other. So we actually launched the pilot this year, and they're seeking to expand the pilot now they've gotten some information with some revisions, and beginning to put together a larger registry where any of us who are doing projects or initiatives in any scope that are scholarship, you can go up there. We have to begin to figure out where we're going to house that database and how people can access it. Another one is the one that we're actually voting on coming this week is we are revising our core values, something at the center. And we sent out a membership survey this year, a large one, along with a town hall meeting. And we got back some clear indicators of the 4 core values that people believe NAP embodies. And so the document for the revised core values is going before the executive committee and then the council. They have moved it forward to change or adopt that. And that's around clarity, our core values. The registry was around community and networking, culture. So trying to think of, we're working more on connectivity between academies, so they actually are connected to work more together, and with members. So this year, for the first time, we held a town hall meeting through a webinar with our members, and we plan on doing 3 of them next year. It was considered to be successful, where we get direct feedback from our members. Our academies are beginning to find more time and ways to connect with one another, to share, because the academies don't all do their business in the same way. They don't meet in the same frequency. Some meet at their meetings. Some meet by webinar every other month. Some have communication. So they're not restricted in how that is, but they hadn't in the past really shared a network across, and we're trying more intentional ways that they actually have some cross communication. They are now doing more shared presentations across academies. So 2 and 3 academies are getting together to submit peer review presentations. So those are some of the goals that have been worked on. And I will tell you, each goal has a co-chair or champion that helps get that goal forward with a committee or subgroup that's helping to make that happen. The NAP registry has a separate one. The last one was public policy, where we had a major goal of going on the Hill in 2019 under Michelle's leadership. And that was extremely successful in interprofessional teams, where many of us were invited to stay longer in the room. We were actually not kicked out after 10 minutes. We were actually asked to remain to share more. And as a result, NAP is now a primary stakeholder in 3 agencies: the Office of the National Coordinating in terms of health information technology, AHRQ, where we provided direct feedback specifically on skilled nursing and the language in that document. And the most recent one is NAP was just invited to be a primary stakeholder with CMS. The other thing is we signed on with the National Academies of Medicine. With the opioid epidemic, we have a substance abuse group, and they're working on professional development training modules that really talk about opioid use management from an interprofessional lens, and we're the only interprofessional group that's signed on with NAM. All the other ones are uniprofessional. So I think maybe that gives you a flavor across the board of the kinds of initiatives that NAP undertakes.
Good.
Did I leave anything out, Michelle?
No, you did a great job.
Good information, good work you're doing. Somebody asked a question about student membership, because the students were mentioned in the associate level. Is that a student who is a licensed professional, but maybe like in a graduate program, or could this be open to any students? And if so, is there kind of a discount for students, or maybe a different fee structure for student members?
Actually, we have had that question come up about students in the past, and I think that that's something that the INO committee is going to be taking on after, we're kind of doing things in priority. But it has been raised, like, should we invite students to be part of NAP, to get engaged with policy related to interprofessional care early. I think for the associate member, though, maybe a current student, I guess I was thinking it more post-licensure, but I don't know if we have that defined. Melanie and Jody, do you know?
I don't believe so, and I have to be honest, I don't know that we have any students in the organization, but I could certainly see somebody who is currently licensed and actually doing an internship or residency or whatever,
Yeah.
joining our group. We don't have what I call professional students yet in the organization, and frankly, we don't have a structure that would address their specific needs. It's not that they couldn't be a member whatsoever, but we've just finally gotten a structure for the associate member collaborative, which was a priority for us for the number of individuals and other types of groups who are very interested in becoming a part of NAP, especially for the advocacy, who we need to find a home in a way that they connect. So that was our first higher priority, and the student one has not, but we would certainly love engagement with athletic training and others to get a sense of what do they think, and is that an appropriate place for them to be, or is it more appropriate that they're in their profession first in terms of where they start this role.
Yeah, I mean, for example, I could think of an example. I have a certified athletic trainer who's a doctoral student in health management and policy with me. I think from a resource standpoint, I think she would have a lot to offer from a public policy, because that's pretty much all they do in health management and policy. But from a cost standpoint, it would be difficult for her to probably pay the dues at the current level. So, I mean, I think that might be, you might need to add some defining factors to that associate level, so people have a better sense of kind of what you have in mind regarding student engagement. Because I think there are some people that are doctoral students that would have a lot to offer because they're curious and they want to work hard and they want to work on projects and all those types of things like that. But however, probably paying not only the $100-some here, but then also the other professional organizations, it adds up when you're on a graduate student stipend or something like that.
Anthony, all great points, and we have a little more homework to do there, I would say, because traditionally NAP really, because it was honorific, didn't really look at a student category because it was designed to be all honorific at the time.
Yeah.
The other thing you mentioned that I think is really important is we welcome doctoral students to submit for abstracts when the call for abstracts goes out for NAP, because you do not have to be a member of NAP to submit for a peer-reviewed abstract or poster or symposia. It is open to anybody who has interprofessional research. The one caveat is it cannot be a uniprofessional single person. It really needs to be an interprofessional team that's doing the presentation if we're honoring what the mission is of our organization. If they have a uniprofessional lens, that could go to your own profession. So that's one of the requirements in any submission.
Any more questions? I'm keeping an eye on the chat box, and anyone can feel free to speak up also if they'd like.
And any questions that come up afterwards, you're welcome to email them to us, and we're happy to get you back an answer on any of those questions if we have it.
Okay, I want to formally thank Jody, Michelle, and Melanie for joining us. We're very excited about the possibilities of putting something together for athletic training in NAP, and the one thing you'll find out about our profession is that we're not afraid to work. We volunteer for stuff. The people that will lead this academy will likely be the ones who aren't afraid to work hard and serve on committees and review abstracts and be involved in collaborative research and all those types of things like that. So I appreciate you taking the time with us today, and your information you presented was excellent, and thank you very much.
Thank you so much for the opportunity, and we are excited about athletic training pursuing this avenue. You have no idea. There are colleagues, and for me personally, there are colleagues as well. I have many who are in athletic training. So good luck, and anything we can do to help in the future, just let us know.
Thank you very much. Appreciate it. Have a good day. Yep,
Thank
take
you.
care.
Bye-bye.
Bye-bye.
And we'll keep this going. I'm going to share my PowerPoint here. let's see. I'm trying to. Okay. Sorry about this. I'll do it this way. Do you see my PowerPoint now, everybody? Do people see it? Hello? Hello?
Yeah.
Yes.
Yeah.
Yes.
Okay, good. Okay, so what I want to do is I want to go through a couple more slides with you and try to get some discussion going. So, obviously Jody and Michelle and Melanie just presented. I think there's some space here for us to be successful. I think also the fact that it doesn't require to get started, it doesn't require a sweeping consensus. I think this can be a purely elective type of group, people that are passionate about this and want to go for it. And I think we can advocate for our profession. Personally, I thought one of the two biggest things that appealed to me about NAP, because I have a lot of colleagues that are in NAP here at St. Louis University, is their public policy role. I think that's really attractive. Also, I think the fact that they engage both the clinical side and scholars and academics, I think it's a pretty exciting. And I think it doesn't require a huge commitment by our profession to be able to be involved and make an impact. I think the nursing is the largest one with 180 fellows, and I think we have a big enough critical mass that we could have an impact fairly quickly in that. I mean, considering the president of NAP is a physical therapist and they started their academy 6 years ago. That's a sign that that people hit the ground running right away. So, does anyone have any comments about their just general impression of our call, and kind of where is this something that is attractive to you, or should we pursue it, or those types of things like that?
Tony, Adam Rosen from UNO. I guess I'm just still a little curious about the actual benefits of joining from a professional standpoint as well as an individual standpoint. So if you have a little bit more insight into that, that'd be fantastic.
I viewed being a part of this as important, is that this is a table that we're not at. That they're dedicated to doing most of what they do interprofessionally, knocking their silos down. And while they're knocking their silos down, our silo wasn't even there to be knocked down. And I think this is a I work a lot in the interprofessional space, and I found the best way to advocate for our profession is to get on people's teams and work hard and show them the value that athletic trainers bring to their team. I think, but if we're not part of these kind of groups, we can't make that impression. There's some colleagues in NAP that probably didn't think much about athletic training before I started working with them, either on NAP or ASAP or AIHC or even at the Journal of Interprofessional Care, and once they saw us get in and roll our sleeves up and work, I think we've made a great impression of our profession there. Individually, I think from a rank and tenure standpoint, I think if you're at a university with a College of Health and Professions, being a fellow of NAP has cachet around here. I don't know at your university or other universities when you're going up for rank and tenure. This is definitely viewed upon as an honor. I mean, I think our university and our College of Health Professions celebrates our NAP fellows when they get nominated. We had 3 this past year, one in speech pathology, one in and actually 2 in physical therapy. So I think that's does that answer your question, Adam?
Yeah, for sure. Also for us, being that the journal's housed at the University of Nebraska Medical Center, I think it behooves us to be a member as well. But that's just from my standpoint.
Yeah, no, I mean the Journal of Athletic Training, the Athletic Training Journal are also housed here. I mean, I'm here at SLU, and I think that's a huge impact on your whole university community. And also, I've worked very closely with Devin Nickel, who's one of the editors of that journal, and it's a very anyone who's tried to publish in the JIEP knows that they cross their T's and dot their I's. You know that if an article comes out the other side of that journal, it's went through a rigorous peer review process, and it's pretty well respected. So that's another advantage, and everybody, even the clinicians who are NAP members, get access to that journal. They don't have to have library access; they have access to the journal as a NAP member. Yep. Anyone else have any comments, impressions, questions, ideas? I know people are thinking stuff, so say it. Anyone? Okay, so hello? Somebody saying something? So one of the big questions I have is how it will be structured and what will be our commitment. I think my feeling was that this is not going to be Tony Brightbox's baby. This is going to be our initiative. I'm just, because I've had some connections with this group, I've kind of set it in motion, but I truly want this to be a organic structure. I mean, anyone, when we worked on the white paper for interprofessional education and practice and athletic training, there was a lot of people involved in that paper that hadn't been involved with a lot of those types of things in the past, and now they're doing a lot of things in the area. So I view this as be very much the same thing. The people that are passionate about it, the people that have the bandwidth, and that want to be a part of this are going to get a chance to have some leadership in this organization, and they're going to co-create the structure of the academy. This is not going to be a top-down. This is going to be a totally collaborative venture. We've had a little bit of top-down over the years, and those things don't quite move as far as we can when we work together. So that's my 2 cents on the structure. Please, people, speak up. I want to hear what you have to say.
Tony, this is Matt Gage, and one question I have for you is, what do you see as how the NAP with athletic training being in there, how do you see that connecting with the NATA, with like state organizations to facilitate our profession?
I mean, I think that has to be a conversation that's had when they talk policy at the NAP level, saying what's happening in your states, because as we know that's where most of the healthcare decisions are happening. They don't happen as much in DC as they happen in the state houses. I mean, there's obviously the CMS decisions and those types of things like that. I think from everything I've experienced with NAP is that, once we're an academy and once we're part of the forum, we're going to have an equal voice, and we can bring forward things like that. But just like anything else, we can't hope that there's no silver bullet to some of the things that ails us, or that are challenges for our profession. I think part of it is this: we need to get in and we need to engage with people, and we need to change the way they view our profession. We need to elevate. If we have a group that gets the ear of legislators, I would love to be a part of that. I also think the NATA I've been fully transparent with this with the NATA. Actually, I ran into Eric Sowers and talked to Mary Beth Hordisky, and they said that Strategic Alliance is fully aware of this, and they are behind it. We just need to reach out and say what we would need from them moving forward. But And I can talk. I have another slide that I was going to talk about some of that stuff too. So, does that answer your question, Matt?
Yeah, it does. Yeah, thank you very much.
Good. Yeah, I mean, really, truly, the members are going to determine where this goes. But the one thing this gives us is, if we're an academy, we're going to be one of 15 on their group, and they have a pretty strong public policy focus. So these are the process. Maybe I should move on to the next steps here, because that's something that I wanted to talk about. Is really, if we decide to do this, we just need to figure out how we're going to communicate, how we're going to stay organized. Whether we do it through a kind of a listserv kind of email string, if we do it through a Google folder, if we do it through something, do we want to kind of have a hashtag on social media that we kind of keep it in front of everybody. I also I'm giving 2 talks at the NAP forum. I got 2 abstracts accepted, so I am going. I'm going to try to bring this front and center when I'm there. If there's other athletic trainers that are going, I would love to organize with you there. And then obviously maybe have an info session kind of at the NATA meeting if possible. So any other comments or questions?
Tony, it seemed like that the process for it didn't involve us becoming individual members until the NAP proposal was accepted. Is that correct?
I think we need to show that we have a group that wants to be engaged. The best strategy that I have been coached on in this situation is that we do need to show that we have some people that want to engage with NAP, even at the associate member level, because then we would be in position to be put up for fellows. We could do it without, we could, I guess we could, considering the NAP council is going to be making the decision on who the first fellows are in our academy. I guess we could have people that have had no engagement with NAP whatsoever be put up for fellows. But I would say a little bit of the informal advice I got from Michelle and some other people like that. If you show that you're engaged with NAP, and then you apply to become a fellow to start an academy, I think you would stand a much better chance than if you just kind of come from left field and even though you might be very qualified. They got burned a little bit with one of the academies and where they got everybody excited and then they couldn't get anybody to do anything. I think they're a little gun shy, so I think they want the newer academies to show that they're willing to engage with NAP prior to being named an academy. So that's the reason why I propose this process. For example, if we have 20 associate members when I go to the NAP forum in 2020 in the spring, I would move confidently, moving forward, saying, hey, we're ready to do this, and I think from what Jody said, I think our first class could even have 20 fellows in it. I wouldn't be surprised with that. The way she responded to my question, they would rather just start off with just a group of fellows than making people. There's very few professional members, so I kind of didn't understand the whole professional membership enough. But it sounds like that first group that starts the academy will just be fellows, and I guess we could try to not be associate members, but I think it's human nature to show that it's a way to show that we want to engage with NAP, and we're not just trying to add a few more letters behind our name. Does that make any sense? Did I answer your question?
Hi, Tony. This is Rachel Hildebrand, and
Yes.
I think a lot of us have kind of mentioned it in comments. But
I can't see
way
those right now the way I'm sharing my screen. I'm sorry.
Yeah, absolutely. I'll just ask. A lot of comments we've kind of said that we're wondering, because, and I might be misunderstanding, but to become a fellow member, you have to have 10 plus years of interprofessional practice and show.
No,
Do you
I
with
think
that?
you'd have 10 plus years as a professional.
Oh, okay, so maybe
Yeah,
I misunderstood.
but you have to have a history of working interprofessionally. So, like, for
Sure.
example, I mean, I've
So,
said over and over, Rachel,
yeah,
that our care model is truly interprofessional. I mean,
sure.
I think it's not a hard. I mean, I think of the 22 years I worked as an athletic trainer. I mean, when I started teaching interprofessional courses, I'm like, this is easy. This is the stuff I've done my whole career, you know. So
Sure.
I think we can very easily make a case for anybody who's been, either working clinically or who's been, engaging with colleagues in scholarship. I think we can make a pretty strong case for that. I'm sorry, I haven't looked at the comments because I've had to
Oh,
share
no,
my
that's
screen.
okay. I think I just I misunderstood. To me, it sounded like you really had to be distinguished in that instead of just practicing. And so I
Yeah.
agree. I think that by definition, we are interprofessional in the way we practice. So,
Oh, for sure.
yeah. And I do think that we can get. At first, I was like, I don't think we probably have 7 to 10 people that can really show. So
Yeah.
fantastic though.
Yeah, no, I think like literally. I mean, you think about some of the people that are working on some veteran athletic trainers who are pushing the envelope on the practice side too. I mean, I think they can become practitioner fellows. I mean, I think, and then think about some of the people that have been more involved at the national level doing things as far as advocacy and those types of things. I mean, they could get involved with public policy. Excuse me. Yeah, I'm very confident we can definitely meet their standard as far as the qualifications and the critical mass of people. I know you all, so I mean I know the type of energy we have. I know the type of work ethic we have. Those types of things like that. I know how we engage with other professions clinically, and scholarly. The bottom line is that do we have enough bandwidth? Do we want to carry the flag? Do we have an intentional way of scaling this up to make sure that it's inclusive and that it's truly organic and not just somebody's project? Because I'm promising to everybody here, even though I'm kind of carrying the flag out of the gate, it's not going to be my little pet project. It's it's going to be the product of many, and we're going to make it happen. So we'll go from there. So, does anyone else have any comments or questions or?
Yeah, Tony, this is Larry Bunger from Texas Tech.
Yep.
What is your engagement? So you're saying get 20 associate members when you go to the conference. And if we weren't able to, like, those dates aren't good for me already, I know.
Yep.
And so what is your engagement outside of conferences that you deal with the NAP group?
To tell you a little bit about some of the work I do, I'm pretty widely engaged in interprofessional education. So I'm an associate editor for the Journal of Interprofessional Care. I'm on the advisory board for the American Interprofessional Health Collaborative. I'm NAT liaison to ASAP. I'm their representative on the IPEC Council. So I intersect with a lot of the Jody Frost and Michelle Trotheth and a lot of Andrea Feifel, who's the president of the Physical Therapy Academy from Indiana University. I work with her really closely in AIHC. So I have a lot of common threads with a lot of people in NAP. Also at my institution, I probably have about 10 NAP fellows here who all have come to me and said, we need to start an athletic training academy. We need to start an athletic training academy. So I think once we start finding out who those people with FNAP behind their name, we need to start engaging with them at our institution, and we need to get them advocating for us. And I think, and I wasn't, I had 2 talks accepted for NAP last year because I have collaborative scholarship I'm doing with people that are NAP members. But we didn't have anything I could fit into as an academy, so I didn't go to the NAP meeting last year. So I'm very interested in going this year. So it's just one of those things where, I think a lot of the work they do is not the NAP Forum. The NAP Forum is actually a rather modest event compared to some of the conventions we go to. Most of the work they do is at the committee level, and they're really organized as far as their committee calls and everything like that. They don't try to put a burden on people, and I think what Melanie said, that as associate members we can get involved with committees, and we can even just something as simple as reviewing abstracts and conference submissions and stuff like that. That's a good way to start getting involved and getting your name out and interacting with people. So, Larry, did that help answer your question at all?
Yes, it definitely did.
Okay.
So we're not, but you're not expecting to have. I mean, if we don't have 10 people at the convention, that's not a bad look on us, right?
No, not at all. No, I think it's a little late in the game for that. But if Melanie Bowser goes to Jody Frost and says there's 20 athletic trainers that are now associate members when they only have 10 associate members right now, I think that sends a really strong message. I mean, I think that we're bashing the door down. I think they want this to work, okay? They just are a little gun shy that the people that are involved can follow through on what they want to try to do. I think towards the end of the call, Jody made it pretty clear that they want it to work. And so I think we need to be more organized on our end. I think the opportunity is there on their end. I think they made that pretty clear on the call today that we just need to figure out a structure that works for us, that we have many voices involved, and we can engage both the scholarly and practice side on our side. Does NAP provide CEUs at their annual conference? Yes, they do, but I think they're through CME. I think they're not a BOC approved provider, so you would have to utilize kind of the CME. They provide nursing and for medicine also. They're also working towards the interprofessional groups are working, like for example, the collaboration across borders. They have this kind of interprofessional CEU group that's been spearheaded by mainly pharmacy was probably the big driver on that. If we can find ways for those to fit nicely into the BOC model, I think that would work well for us. But I do know that like physicians get CME for it. I think a pharmacist, nurses, physical therapists get CME for NAP. But we'd have to define exactly where it would fit in the BOC. Any other comments or questions? We're getting pretty close to 4:30 Central Time, so I want to be cognizant of people's time. So, because I'm not hearing a lot, I'm going to suggest the next step. So, what I would like to do is I would like to send out this recording to everybody who showed interest, okay? And then what I would like for the people, if someone is interested, I would like them to email me back and say, hey, I'm interested in doing this. And then we can still engage everyone who's shown interest, but also we can start to kind of brainstorm on ways we can communicate better, maybe organize a little bit better, those types of things like that. Does that sound like a reasonable approach?
Sounds good to me.
Hey, Tony.
Yes.
This is Stephanie at TCU.
Hey, Stephanie, how are you?
Hi, good. I'm just curious if once you send this out, do you want us, if we have colleagues that are really involved in interprofessional education that aren't on this call, can we share it with them to try to get them to come on?
Absolutely. I think one of the things I was interested in doing also is to write an article for the NATA News, and just let people know that this is out there, especially to try to engage in the clinical side. I think also that's one of the things that Eric Sowers mentioned to me when I ran into him at the ASAP meeting, saying that the NATA and the BOC can be a good vehicle to kind of engage. One of the things that we were thinking of really engaging with is the physician practice group also, or those merging settings also, the COPA group and stuff like that. I think I think as wide of a swath we can do, the better. I think we just need to make sure that the people that are involved from the beginning are willing to put the work in and follow through on what we started. But yeah, please share with colleagues that may not have been on this. I kind of utilize social media and kind of that list of names that gets sent around when people have job openings, that kind of list of names. That's kind of what I started with, and that's really how that happened.
Okay, thank you.
Yeah. Yeah, and anyone else have any comments, questions, concerns?
Yeah, Tony, I'll say one more thing. I did attend last year. I did an IP presentation with several colleagues from our university and another health science center, and it was amazing how many topics crossed athletic training. So when you're saying that this is an opportunity to have a place at the table, I think it's really important. So unfortunately, I can't make it this year. We do have a poster that went forward and got accepted. So yeah, I think it's a great opportunity. So I appreciate your leadership on this.
Yeah, no, it's a good group too. Like they really want to walk their talk. They really, by structure, I think Jody and Michelle and Melanie indicated that they really want to make this a space where people kind of they advocate for their profession, but advocate it as a part of the team. And I think it's a good combination of things. I think it's not stealing any thunder from any of the other groups that are doing work right now in athletic training. I think it's a different thing, and I don't think it'll subtract from any of the good efforts that are going on right now either. So, anything else? Questions, concerns? I did see a few of the chats come through, which is good. Thank you. Maybe we can start to involve our clinical coordinators as far as dissemination of some of this too. You may have some clinical champions at your universities that might be good people to recommend that they become involved. That maybe they're looking for a new challenge or a way to engage with colleagues. They might be a part of a health system of some sort that they naturally work together with colleagues, those kind of things like that. Okay, cool. So I think I'm going to hang it up real quick here. So a couple action steps, everyone. First action step is I'm going to take the recording of this and send it out to everyone who showed interest in that original form I sent out, because I know some of the people couldn't be on this call because they were doing things. Number two, I will work with Mary Beth, who's my contact at the NATA, on doing some sort of social media blast, some sort of either a electronic blast or putting something in the NATA News about this. And then I just want everyone to, when you get the email from me, if you're really excited about this and you want to kind of be involved with some of the generation of ideas and kind of the laying the groundwork for this, and you have the bandwidth to do it, reply to me and let me know. That way we kind of get a core group that maybe starts doing some of the research and writing and those types of things like that. Also let me know if you intend to become an associate member, so we got a sense of who our numbers are. And then, but none of this will be done, everything, we'll try to be transparent with everything, so everybody kind of knows what everybody's up to. I don't think anyone wants to reply alls to everybody because those are a pain. No one wants to full inboxes, but I think if we get going on that, maybe I can send out an email, once a month or something, and let everybody know kind of where we're at on the whole thing, and if more people want to get involved, and if you want to tie more people in. Does that make sense? Okay. Thank you, everyone. I appreciate your participation in the call, and you will be hearing from me very soon with this link, and we'll go from there. Okay?
Thank you.
See you later. Have a great day. Have a good Halloween. Hope you eat a lot of candy.